Hello, welcome. My name is Daniel Stillwell. I'm the IFTA e-newsletter, and we have with us today Zenobia. And I would like you to introduce yourself because I will ruin your last name. Where are you from? What kind of therapist or clinician do you identify as? And what do you do?
My name is Zenobia Niculiță. I come from Romania. I work there as a couple and family therapist in Bucharest, the capital.
Mm-hmm.
I have been working as a therapist for the past 6 to 7 years, but my main job is still in education. I work as a professor.
Okay.
Teaching research methodology,
Mm-hmm.
social sciences, and social psychology mostly.
Okay.
My main area is couples therapy from an integrative approach. So I don't really identify with any of the main schools of therapy,
Right.
or we could say I identify a little bit with all of them.
Mm-hmm.
But I think mostly I use EFT and Gottman method and a little of family faith systems too.
Okay, that makes sense. Yes, if you're going to be building your own, go with the ones that definitely work.
Mm-hmm.
So that's nice.
Of course, even though it's not a family or couples therapy approach, I find myself using a lot of the methods that come from trauma therapy.
Mm.
It comes natural in a way.
Okay. And for you or for your clients?
For my clients.
Okay.
I think that it was not the way I was going to go when I started, but it seems like, at least lately, it is required.
Mm-hmm.
Most of my clients come with a lot of trauma, individual trauma or family trauma.
I had a teacher once tell me that you become the kind of therapist that your clients need.
Yes, kind of.
So, yeah.
I believe that about myself as well. I started open-mindedly about this,
Mm-hmm.
and I find myself being mostly a couples therapist because I get a lot of couples
Mm-hmm.
as clients.
Okay. Well, you're here at the conference here in Spain. Tell me about your presentation, and you can go anywhere you want.
My presentation derives from a long-term interest that I had in the psychology of forgiveness. It is pretty obvious how that would play into a therapy context.
Mm-hmm.
And this is why I've tried to apply this to a couples therapy context.
Mm-hmm.
The main issue is, how do you distinguish between forgiveness as a skill that you can teach and you can learn, especially in a couple context, and the same name or concept that can become a dysfunctional pattern within intimate partner violence couples, or even abusive couples, or power play. So how do you distinguish between that as an individual and as a therapist working with these kind of couples?
Mm-hmm. Almost the difference between empowering someone versus enabling someone that we talk about in addiction work.
Mm-hmm.
It sounds
Mm-hmm.
like there's some layers.
Mm-hmm.
Okay.
Mm-hmm. So I'm going to present that theoretical distinction, and then a little bit of a research that has started a long time ago. It is a mixed type of research, both quantitative and qualitative, but I'm only going to present some qualitative data regarding forgiveness in the couples.
Mm-hmm.
It is a long-term research that tries to understand how couples manage their emotions, mostly anger, within conflict,
Mm-hmm.
and how do they get from there to the coping mechanisms that enable them to function after
Okay.
a violent conflict or violent display of anger. And forgiveness is just a little bit of it. It's
Mm-hmm.
one of those functional coping mechanisms that partners may enable and use post-conflict.
Okay. Do you have a definition of forgiveness that you're working with?
Starting from the American Psychological Association's definition of forgiveness as a change in attitude,
Mm-hmm.
I think that it is important to see the concept. Well, I'm thinking of Shakespeare's idea of how do you call by a rose by any other name.
Right.
I think that forgiveness is one of those concepts that you call forgiveness, but sometimes you feel like it should be multiple things and it should be defined with multiple definitions. So I would define it as a change in attitude from resentment and revenge and emotional blockage towards healing and maybe even post-traumatic growth. So empowering yourself in this change of attitude. But also I would define it as a set of skills that you can acquire in order to be able to function properly and set healthy boundaries and understand and assume responsibility for your involvement in the situation, but towards yourself and not the other. So this is a set of skills.
Right. Yes. Even in my own couple's work, it's not uncommon for one partner to apologize, but basically just get defensive. And so they forget that it's supposed to be about that repair process. So yes, certainly some of it can be taught.
Of course, and also we live our lives on both sides of forgiveness. So we can learn the skills to ask for forgiveness and assume responsibility, and in the process learn how to forgive ourselves for the things that we ask forgiveness for.
Right.
But also it is a set of skills regarding offering forgiveness and being able to let go of the things that we need to let go without falling back into dysfunctional patterns.
Okay. All right. Any other takeaways for the viewers about your presentation or your work?
Well, for me, it's a passionate topic. So I could stay here and talk about it for 1,001 nights.
Yes.
But really, I'm waiting for anybody who is interested in order to start a conversation that is productive and useful for all of us to take into our practice.
Well, then my last question would be, what does this look like in a Romanian context that might be different than other places around the world? I'm from the US, and so I'm sure it is different.
Well, I think forgiveness is one of those concepts that is transcultural. I mean, it definitely has ways of expressing that are culturally modulated, but actually the process in itself is like memory and love and attachment. It transcends culture. So I would not say that there is a Romanian way to forgive. But I would say that being a traditional society, I would say that mostly a patriarchal society yet.
Yes.
Still. The idea of forgiveness is met with a lot of reluctance in therapy because it is still regarded as a moral imperative more than a healthy way to go forward.
Okay. All right. Well, then that's a good human scale way to end that conversation. Now let's end with something fun. You're in southern Spain, but you come from Romania. Where in Europe do you like to travel?
Anywhere really. I think that I find something very familiar in Europe compared to the US, for example, where I do not find myself.
Okay.
Even though it's interesting to travel there, and I like to see different things. I really like to just walk around places and see what I find, see what I see.
Okay.
So there's no favorite place to me, but rather I see Europe and, well, the world really as a place to wander.
Oh, what a great way to end. All right. Zenobia Niculiță?
Yes.
All right. Thank you so much for joining with us today and
It was my
being able to
privilege.
share.